Hello and welcome to Back to Health. My name is Dr. Philip Corbin. I am a chiropractor here in Bella Vista. My degree is in exercise physiology from the University of Oklahoma. I'm American College of Sports Medicine certified health fitness instructor and cardiac rehab specialist, and went to Palmer College of Chiropractic. Today we're going to cover two topic areas that we see quite frequently in the office, and that is restless leg syndrome and sciatica. I also have as a guest today Miss Joan Goles, and we will be talking with her a little bit about her story and what she has to tell everyone in regards to her condition. Okay, restless leg syndrome is a disease that is non-specific. It is a symptom-oriented disease. It's caused by a powerful urge to move your legs. The legs become uncomfortable when you're lying down or sitting. People describe it as a creeping, crawling, tingling, or burning sensation. And moving makes your legs feel better. Lifestyle changes, regular sleep habits, and all these things can be affected by restless leg syndrome. And it seems a lot more frequently we're hearing people coming up with this as something that they're dealing with. How is a diagnosis of restless leg syndrome come about? Well, you have what are called diagnostic indicators, and that is part of what I was saying a little earlier in regards to it being a symptom-oriented diagnosis. And so you have these indicators, the desire to move the legs being the primary one, and motor restlessness is just another terminology for the same thing. Motor meaning movement. You have this desire to have your legs moving, and the more so, the less uncomfortable they become. You'll have symptoms that are worse in the evening or at night as you sleep, particularly in a lying down position, and they are given temporary relief by movement. The last thing is you have the symptoms that are worse during the evening. All of these things are indicators that restless leg syndrome may be present. What causes restless leg syndrome? It is unsure. Okay, primarily the primary indicator so far in the research is showing that there is an iron constituent involvement in the central nervous system, and it's either faulty use or lack of iron. Iron, which is then is in the formation of dopamine, which dopamine is a central nervous system chemical that is very critical to controlling movement. So if there's an iron deficiency issue, then you'll have you could have these symptoms start to occur. Some of the conditions, however, that can create an iron deficiency, we see lots of. Okay, kidney issues. People with Parkinson's or diabetes will have iron deficiency issues. Rheumatoid arthritis, pregnancies, other iron deficiency diseases like sickle cell anemias and those types of things can be precipitating factors associated with the disease of restless leg syndrome. Nerve damage is another possibility in this regard, and it makes a lot of sense in that the nerves are involved in movement, and the irritation to these nerves would follow that you could have a lot of involvement in the nerves themselves. Medicines can cause restless leg syndrome. Things like anti-nausea, antidepressant, antipsychotic, antihistamine, calcium channel blockers, which is used a lot in high blood pressure medications. All of these can have been shown to give restless leg syndrome type symptoms to people as a side effect. What are the treatment for restless leg syndrome? It is very broad-based and very non-specific. Nutrition and supplementation to deal with the iron component, then and helping the overall system itself in a better nutritional way has been shown to have some good effects. Medications, dopaminergics, benzodiazepines, these are all central nervous system depressants or pharmacological interventions. Opioids and anticonvulsants, all they do, these things are depressing central nervous system and essentially decreasing your ability to understand and perceive the symptom of a restless leg. Exercise and rehabilitation is the primary treatment for these, and has been shown to be probably the most beneficial, and has been shown to be treated very successfully through chiropractic care. In association with restless leg syndrome and the idea of the nervous system and the anatomy associated with what we're talking about in restless leg syndrome, very common secondary condition that we see is a condition of sciatica. Okay, and sciatica is a disease that is a symptom of the problem associated with the large nerve that runs from the lower back down the back of the leg, and it controls the muscles from the knee and the lower legs, provides feeling to the back of the thigh, part of the lower leg, and the sole of the foot. Sciatica, again, this is a symptom-based diagnosis. It is due to the anatomy, irritation along this very large, very critical nerve in the lower extremity that is irritated, and you will have a sciatica diagnosis come from that. Sciatica symptoms can include pain, numbness, muscle weakness, tingling, pins and needles sensation. You can even have a loss of bladder or bowel control associated with the irritation to this. So it's a very critical part of our anatomy, as I was discussing. What causes sciatica? This is probably more critical than what it actually is, the condition itself. Primary causes are nerve root compression or disc issue. In our last episode, we discussed disc herniations and degenerative disc disease. We were talking about the anatomy associated with the spine itself and where the nerves exit the central nervous system out to the periphery. And so you'll have disc issues. You can have spinal stenosis, which literally means a decrease in size of the space that the spinal cord is allowed to pass through. Spondylolisthesis, which is spondylo meaning spine, listhesis meaning shifting. One vertebrae in comparison to the other will shift forward and put an increased pressure on the anatomy associated with the central nervous system. A secondary thing that is very, very common is what is called piriformis syndrome. And piriformis is an external rotator muscle in the gluteal area. And when this muscle becomes hypercontracted due to where it is located, it can put direct pressure upon the sciatic nerve, creating the symptoms that we call sciatica. You can have spinal tumors. This is one of those things that can happen. It's not really a common thing, but it's out there. And trauma, be it repetitive or a car accident or anything like that, can be associated with creating the symptoms that create sciatica. And so we are looking at the anatomy associated with this area of our body, and we look at then these mechanical interventions then create the symptom that we call sciatica. The tests that you would experience in either of these conditions, first thing, you're going to get a complete history, orthopedic and neurological evaluation, and that means we're going to determine whether or not there are muscle weakness, diminished information coming into you through sensory perception of pressure, vibration. Those types of things are very critical to tell which part of the central nervous system is being affected. You're going to have diagnostic tests of blood work, x-rays, MRI and or CT scans. All of these things are looking to give you information associated with, particularly in the imaging, you're looking to see if there is an actual discal issue or